Question 5, Jim Hume.
Thank you. To ask the Scottish Government what discussions it has had with Police Scotland regarding how it deals with incidents involving people with mental health issues.
Secretary Michael Matheson.
Over the last 3 years, the Scottish Government has engaged with a range of partner organisations, including Police Scotland, the NHS, social services and the third sector, to consider ways of improving how services respond to people who may have mental health problems and to people who present in distress. This has included several stakeholder engagement events, 2 of which were hosted by Police Scotland. A mental health community triage pilot with local policing and Greater Glasgow and Clyde Health Board was approved and implemented in January 2015. This new approach provides officers with direct access to mental health professionals who help support decision-making to improve services to vulnerable members of our community. In August last year, a similar pilot was launched in Edinburgh City in conjunction with Lothian Health Board.
Jim Hume.
I thank the Cabinet Secretary for his answer, but the Cabinet Secretary didn't provide information on the number of incidences that Police Scotland respond to in relation to potential mental health problems. So has there any assessment been carried out of what proportion of incidents the police attend that involve a person with a potential mental health issue, and does he agree with me that there is a greater scope for health professionals to be more involved in such Police Scotland responses?
Cabinet Secretary.
Sign officer, I'll check to see where there is central information on the very specific point which a member made reference to. But what I can do is give them some information in relation to the project which we've been running in Glasgow in terms of its particular impact. Over the course of a year, there were 234 incidents which were attended to. 225, which is 96%, were found where the individual appeared to have mental health issues, were found to be fit and well by a CPN, and there was no need for further intervention. And of those, some 86% of incidents were resolved by telephone consultation between a CPN and individual concerned. What the evidence does show us the very significant impact that can actually have on police time and also on individual affected who may have mental health issues or been presenting in distress, to make sure they get the right assistance and support as and when required. And I know from time that I've spent with British Transport police officers, they find that also invaluable because of the assistance it gives them, given it very often there can be issues around train stations and railway lines where individuals are vulnerable. And what we want to do is build on that. That's why that project is now rolled out into Edinburgh, and we're also working with Police Scotland and other health boards to look at how we can then roll that out into other divisions within Scotland in order to make sure that when an individual has a mental health issue, which is a primary issue, that they get the effective support and assistance which is required in order to make sure they get the assistance that they need at that particular point.